Welcome to York Teaching Hospitals NHS Foundation Trust's Maternity Tour. We're going to look at the two main sites, York and Scarborough, but we also deliver care from Bridlington, Malton, Whitby and Selby. If you are midwifery-led care, you can choose to have your baby at home, and our community midwives provide an on-call service for you. You can discuss this further with your community midwife. If you choose to have your baby in hospital or advise to do so as you are consultant-led, you can have your baby at either Scarborough or York maternity unit. Parking for York Hospital is at the rear of the maternity unit and has a designated parking area which you can use for the duration of your labour. The maternity entrance is opposite the car park. At Scarborough, you park in the main car park and enter through the main entrance, unless overnight when you come in through A&E. You can contact the hospital at any time during your pregnancy if you have any concerns or need advice. All telephone numbers are on the front of your handheld notes. If you think you might be in labour or your waters have broken, you need to contact triage at York or labour ward at Scarborough Hospital. The midwife will talk to you about what's been happening, and you may be advised to come in for assessment or encouraged to use some coping mechanisms at home and call us back when events seem to be progressing. During your pregnancy, you may be admitted to the antenatal ward. At Scarborough, this is a mixed antenatal and postnatal ward. Often it is because we need to undertake further assessment of you or monitoring of your baby. You would also come here if you require induction of labour. The labour wards have a range of different types of birthing rooms. There are pool rooms for women who wish to labour or birth in a pool or use the birthing chair, and there are rooms for women who are wanting epidural pain relief or need to have more monitoring during their labour. We will provide you with evidence-based information to support you to make choices that feel right for you. Pain relief is discussed in detail in the labour chapter of these videos, but pethidine and epidurals are available on both sites. Gas and air is available in the rooms and also for women choosing to birth at home. Pain relief options can be discussed during pregnancy with your community midwife to form part of your personalised birthing plan. We encourage and support active birth and aim to provide all women with positive birth experiences that fits their individual needs. In some cases, it might be necessary for your baby to be born by caesarean section, and both York and Scarborough have the facilities for this. This will be discussed with you fully at the time. Some women choose to go home from labour ward if they've had a normal birth with no complications. Other women will stay and will be admitted to the postnatal ward. You can get support with your feeding and baby cares on the ward, and it is really important to let us know if there is anything we can help you with. If you contact us during pregnancy because you are worried either about you or your baby, you might be invited in for assessment. At York, this is attached to the clinic area where you came for your scan, and at Scarborough, it is beside the antenatal postnatal ward. Scanning facilities are available at York, Scarborough, Bridlington, Malton and Selby. We have special care baby units at both York and Scarborough sites, providing specialist care for babies who require more support than can be given on the postnatal ward. Care will be provided by paediatricians, neonatal specialist nurses, nursery nurses and healthcare assistants. We have bedrooms on both sites that can be used for rooming in to support you to care for your baby prior to discharge home. Once discharged home, you will be seen for a visit at home by your community midwife the following day and then invited to postnatal clinics thereafter.